Welcome to the Trillium Show, where each week we discuss different tips to help you improve your mind, your body, and your life. I'm your host, board-certified plastic surgeon and medical director of Trillium Plastic Surgery and Trillium Aesthetics, Dr. Jason Hall. And you don't need anything that I have to offer. You may want it, but you certainly don't need it. Body contouring and body lifts are a hot topic right now, especially with every person you meet taking Ozempic or Mounjaro for weight loss. There is going to be a lot of loose skin flopping around in the near future. In this show, I'm going to discuss surgical body contouring, which includes the tummy tuck or abdominoplasty and the body lift, also known as the 360 or the around the world. Known to us dorky medical types as a belt lipectomy. Which of these procedures you need ultimately depends on how your body is shaped and where you carry excess skin. As a general rule, if you have had weight loss surgery or have lost a significant amount of weight, you'll probably need a body lift. If you've lost 60, 70, or 80 plus pounds with diet and exercise or with medical weight loss like Ozempic, you'll probably need a body lift. If you're a mom who has had a couple of kids and you want your pre-baby body back, try saying that 3 times fast, maybe with a little improvement, then a tummy tuck is usually the right operation. So what are the goals of body contouring? Well, there's 4 of them. Number 1 is to remove excess abdominal and trunk skin. Number 2 is to remove excess abdominal or trunk fat. Number 3, and this is a big one, is to tighten loose abdominal muscles. And then finally, the goal of all 3 of those is to improve your silhouette. Now, what does body contouring not do? And this is really important. Body contouring of any kind will not improve stretch marks. Now, it will remove stretch marks below the belly button. It will not improve upper abdominal skin laxity. So loose skin above your belly button will get a little bit better, but won't significantly improve. And then lastly, it will not improve poor skin quality or cellulite. Now, it's important when we talk about any surgical option to understand where the scars are. So the scars for body lifts or for tummy tucks are low on the abdomen, hidden in the bikini line. The other scar, and this is the one that really gets people, is the one around the belly button, should be buried inside the belly button. It shouldn't be something that you see. And we've had videos, you can link to this one here, where belly buttons can tend to look like a cat's ass, for lack of a better term. And that's not what you want to see. The scar should be hidden on the inside. In some patients, and this is especially true in the skinny patient who is having an abdominoplasty, there can be a small vertical incision between your belly button and your bikini line scar, but that is only for really skinny patients that need little skin removed, and most of what we're doing is muscle surgery, is tightening muscles to kind of give people back that flat stomach. And then for body lifts, that scar from in the bikini line continues all the way around and kind of meets right above your butt crack. So how is this stuff done? Well, in my practice, body contouring is done using a general anesthetic. So you have a breathing tube. These are typically longer surgeries. Before surgery is done, I use something called an ultrasound-guided tap block, sort of a transversus abdominis plane block, for postoperative pain control. And this is really important, and I'll link to the video here where I discuss that. But what that does is a couple of things. One, it improves your postoperative pain control, so you don't wake up hurting, which is mostly from the muscle repair, nearly as bad as you would if we hadn't done that. The second thing that it does, which is I think is almost as important, if not more important, is that it allows us to use much less narcotic pain medicine during your surgery to keep you comfortable while you're asleep, which improves your waking up. You're not as groggy and kind of drunk feeling when you wake up. It improves your immediate postoperative pain control, and it helps you to get up and start moving a little bit better the day of surgery, which is super important. It's important to note, though, that the day of surgery, you're probably not going to remember a whole lot until dinner time. Just from the way that we do our anesthesia, you see me in the preoperative holding area, and then the next thing you know, you wake up on your couch, you kind of forget everything in between, and that's normal. We want it that way. From a recovery standpoint, most patients spend between 30 minutes and 1 hour in the recovery room. You do have to have a driver bring you to and from the surgery center. You do have to have a responsible adult, and that's up to you to determine, to stay with you overnight, just because you're still under the effects of anesthesia, and we want to make sure that you have help there if you need it. For most of my patients, you're going to have a drain after a tummy tuck or a body lift. Typically with a tummy tuck, you have one. With a body lift, you may have 2 or 3, and those typically stay in place for about a week. Believe me, they sound a lot worse than they are. I've got a video here that you can refer to where drains we kind of review the whole drain thing and how to take care of them. But relax, they're not as scary as they sound. In terms of checkups, we call you every single day. We'll check in the night of surgery. We'll check in every single day. Want to make sure that you're up and moving, you're eating, pain's controlled, and things like that. Typically, between days 5 and day 7, we see you back in the office. Usually that's when our drains are removed. And then we leave you alone for a little while. We let you recover, let you get back on your feet, start doing more normal things. And see you back then at 6 weeks when we get you out of your garment and things like that. It's very important following any of these surgeries that you shower the following day. It is okay to get your incision wet. As a matter of fact, I want patients getting their incisions wet and showering, even though I don't want you submerging that drain and not taking a bath for about 2 weeks. Swelling from any of these surgeries is going to peak between the 2nd and the 4th day after surgery. That's when you feel the most bloated and puffy, and really kind of all of that fluid is accumulated in your tissues. It then starts to mobilize. You start to pee a little bit more and get rid of a lot of that fluid starting on day 4. Most people will return to work and social activities at between a week or 10 days. If you have a job that's really active, you're on your feet all day, every day, I ask people to take about 2 weeks off from after surgery just so they can get on their feet. They are used to kind of moving around. The tightness in your stomach is tolerable to work an entire 8-10 hour shift. And so 2 weeks for active people. It's important that to note that you will have some intermittent swelling of your lower abdomen, which can last up to 6 months. And this is swelling that kind of comes and goes. Some days you'll be swollen, some days you won't. But that typically, as your body's healing, takes about 6 months for that to go away. Your incision lines during that time, will still be pink. They'll still be kind of stiff. Now, we use and recommend topical scar treatments, which we can start as early as a week after surgery. So that first in-office visit, a lot of my patients will start on silicone treatments. If you've had problems with scarring and want to be super aggressive, we typically will start laser treatments at about 2 weeks after surgery, if that's the way you want to go. It is important to note that both for shape and for scars, final results takes about a year until the final results are visible. But you will look a lot better right after surgery. So what are some other procedures that we can do? Well, liposuction is done in probably 98% of all body contouring procedures. Only but the absolute skinniest of skinny tummy tucks, where we're just really tightening muscles, or doing a mini abdominoplasty, do we not use liposuction in body contouring cases. A breast lift with or without implants, the mommy makeover, is also a very common procedure to combine with abdominoplasty. Now, in my practice, I don't do breast surgery and body lifts at the same time. it just is too much surgery for me and for you. Now, if you're going to a place, usually an academic medical center or some specialty practices where you're going to have two surgeons and their assistants operating at the same time, then breast surgery and body lifts can be done together. If this is something that you're interested in, ask your surgeon or ask their coordinator before you go in for a consultation. So what are some reasons not to do this? Well, I think we need to really pay attention to people with poor tissue quality. If you've got really thin, crepey, inelastic skin, kind of thin skin that just kind of not good quality, that's not going to change. And it can be real problems for scar migration. It can be real problems with healing. So that's one thing we really have to be careful. Not that we can't do surgery, we need to be careful. People who are unrealistic. If we, after a lengthy discussion, if the results that I think you're going to get aren't a result that I think is going to make you happy, going through a big expensive operation with all the recovery doesn't make a lot of sense. Patients who are on blood thinners, have bleeding conditions, who have uncontrolled high blood pressure, heart problems. Cosmetic surgery in general is not a good idea, but really I think twice about having surgery where there are large areas that can bleed. If you're on nicotine, this is a real no-no with most of plastic surgery. Nicotine includes smoking, obviously, vaping, nicotine gums, Zen pouches, marijuana. All of these things should be avoided both 2 months before and after surgery. They damage the small blood vessels in your skin that we rely on for healing, can cause healing problems, can be real issues with wounds, especially in big body lift surgeries, that can cause very lengthy recoveries. So no nicotine for 2 months before or after surgery. One that's really kind of a new one for all of us in the last couple of years is Ozempic and any of the GLP-1 agonist medications. So Ozempic, Mounjaro, Wegovy, there's a long list of them, as well as immune modulators. So if you've got inflammatory bowel disease, rheumatoid arthritis, we need to be off of all of those for 6 weeks before surgery. Those things, the immune modulators can really wreak havoc with healing. Ozempic and those other medications essentially paralyze your GI tract and can cause anesthesia problems, real serious anesthesia problems. So it's important that you're off of all of those for 6 weeks before surgery. So some things to be careful about before any surgery. First of all, it's important to understand that healing is something that is individual and something that's genetic. I do the operations the same way every time. I use the same material, same sutures. I use the same tools. And I have some scars that are really great. You can look at my website. I have a lot of really great scars. Got some scars that aren't so great. Have some scars that need to be revised every once in a while. And those are a thing. And revisions are a thing and may be needed later, although they're rare. But you have to be prepared that if you have surgery, there is the possibility that that may be you. Revisions also for unsatisfactory results. You may have a dog ear, which is a little excess tissue at the end of your incisions. You may have some irregularities from liposuction. And those are things that, revision surgery can address and can address successfully. But understand that stuff may happen, and your surgeon should be willing and able to treat those little things for you if they come up. Another thing to think about is that you will have some imperfections that you will notice after surgery. There will still be some things there. Belly buttons aren't always right in the middle of your abdomen. Now, we point those out to you. If you're one of those people that has a belly button that's a little bit off midline, I'm going to tell you about that before you have surgery, so we don't have to kind of go back and explain it afterwards. But know that stuff like that is more visible because you've just had surgery and you're paying attention to it. Something especially in body lift is that because of differing tension, especially in the hip area, some scars may settle and not be just straight as an arrow because of the way the tension works. Usually those stay within a bikini line, but know that that is something that happens. One final word about patients who have lost a lot of weight, whether that's a body lift patient who has had gastric bypass surgery, whether that is a medical weight loss patient who's been on one of these GLP-1 agonists and lost a lot of weight, is that nutrition is crucially important. And it is our job to make sure that your nutrition is optimized and adequate for healing before we have surgery. If your nutrition is not, if you're still malnourished from significant weight loss, then you can and will have healing problems. And some of these can turn into big wounds that take months and months to heal. And so it's important, if you've lost a lot of weight, that we check labs, we do blood tests beforehand to make sure that your nutritional levels for healing are adequate to heal such a large area. And what a lot of patients who are in for a body lift who have had gastric bypass surgery will say is like, oh, gastric bypass is a huge operation, and it is. And I sailed through that, no issues. And what people don't understand is that the amount of healing that we ask your body to do with any of these body contouring surgeries, specifically a body lift, is enormous. And the nutrition requirements for that are enormous. And so it's really, really important that we check your blood work, make sure that you've got enough bricks to build the house that we're trying to build, so that things don't come apart in that first couple of weeks after surgery. So what are the things that can go wrong? Well, we've talked about wound problems, and those, fortunately are very rare. And we check your nutrition to make sure that we don't run into those problems. Hematomas or blood clots underneath your skin, which can compromise healing. Fortunately, those are very rare. Fluid collections under the skin. These are referred to as seromas, and it's the reason that we do a lot of suturing underneath called progressive tension suturing. It's the reason that we put in a drain, kind of a belt and suspenders, to prevent seroma fluid collections. They still happen. Even when we try and prevent them, they can still happen. Fortunately, these are really more of a pain in the butt than a serious problem, because once we identify these, we have you come back every couple of days in the office. We can drain them with a needle in the office, and they typically will go away. There's the very odd one that needs to be drained in surgery, but that is really unusual if we catch these things early. You will have some temporary numbness of your abdomen. A lot of people are surprised that their stomach is numb after a tummy tuck, and that is expected and happens to almost 100% of people. Fortunately, most of that comes back with time, but it does take a while. We already talked about poor scar healing, and then liposuction deformities, little craters and divots, also can happen. Fortunately, those are fairly rare. So I hope you've gotten a lot of information out of this. As always, thanks for listening. If you enjoyed the show, please leave me a review on Apple Podcasts. This helps other people find the show. If you have an idea you'd like to see made into a show, or have a question you want answered, please send me an email, media@drjasonhall.com. Drop me a DM on Instagram or X @drjasonhall. You can also leave a voicemail and be anonymously featured on the show by going to the link in my Linktree bio on Instagram. Thanks again, and we'll see you in a couple weeks.